being a educated consumer is extremely important to me.
Robert Smith has Crohn's disease and says he went to the doctor in the fall of 2020 for a routine colonoscopy, a procedure he's gotten for years. All was well until he got the bill.
A colonoscopy in Florida is not going to be as high as a colonoscopy in New York City, but twice as much.
Smith doesn't want to be identified because he has family members who work for NYU Langone, the hospital he visited. Billing statements from Smith show the total charge for that colonoscopy hundreds of dollars higher than for his last colonoscopy with New York Presbyterian in 2015, even though he had the same insurance. Even when adjusting for inflation, Smith says it isn't close.
Prices can vary based on who your insurer is, who the hospital is, what their relative sort of position in the market is, how well they can negotiate.
Kaiser Health News reporter Julie Appleby says a lot goes into the cost of a procedure, varying from one hospital to the next. In Smith's case, a letter from NYU Langone states the difference came down to the negotiated rate with his insurer. We reached out to NYU Langone repeatedly for comment and never heard back. In 2021, the Centers for Medicare and Medicaid Services implemented the Hospital Price Transparency Rule, requiring hospitals to put their prices online in a way that's easy to read so that consumers could know before they go.
Why wouldn't anyone want to know where they could get a $300 MRI versus paying $3,000?
Today, the NYU Langone website does feature a cost breakdown and tools to help consumers know their estimated cost and potential additional charges, although we're not sure when that info was added. Cynthia Fisher with PatientsRightAdvocate.org says while NYU may have the info, the majority of hospitals haven't followed suit.
We are over 20 months into the law requiring all hospitals to post their prices. And unfortunately, only 16% of the hospitals in this country are posting all of their prices.
The federal government has fined 2 hospitals a little over $1 million for noncompliance. A spokesperson telling Newsy as of October 2022, they've issued 388 warnings and requested 204 corrective action plans, adding that 243 hospitals had addressed previous citations.
Within a couple of weeks, those hospitals posted exemplary files where the prices are now easy to find in those hospital systems. That is success to change the game.
CMS encourages the public to report any hospitals that aren't in compliance via their website.
Some of the larger hospitals could face fines of up to $2 million for not posting this. So there are some teeth in that law.
Smith was a squeaky wheel, challenging the billing department, keeping detailed notes, and filing complaints. He says NYU Langone never admitted fault, but eventually absolved the balance.
Being an educated patient and consumer is very important because you'll find that a lot of mistakes are being made.
Transparency rule isn't perfect, and sometimes the prices are difficult to find online. Still, Fisher says it's a step in the right direction to making the cost more competitive.
It's broken. So the only way we can change the system is when we as patients have power to be well informed about our health decisions, both on our quality of care, but importantly on the prices of our care.
Amber Strong, Newsy, Washington.